Hi guys. So welcome to the EPIC Master Clinician program. So I'm going to be doing the couples counseling part 1 and part 2. Part 2 will be happening in the next month. This is part of the program of year 1 of our EPIC training, and this is session 7. So year 1 is typically for all of the introductory courses, so that these are the core things that we want you to learn. Year 2 is typically for more the advanced kind of programs. And so going forward, I just want to let you know that. So today's agenda. So I am Dr. Cory Hrushka. I am a registered psychologist. I am the CEO of Insight Psychological. I am also a certified sex therapist. So a lot of the stuff that I will do from a couples counseling perspective, there's some crossover with my sex therapy training. So in terms of today's agenda, we're going to be going into some housekeeping, a few things to consider. I'm going to go over some of the methods for couples counseling for you guys to be aware of. I'm going to be talking about a little bit of some of the gender differences and sex differences. And they are different. And so although I discuss it more in my sex therapy training in terms of the sex and gender differences, it's something that I think is just crucial to understand, that there are some differences and what they are. And I'll go into some of those details. I'm going to be also talking about normal marital sadism, which is an interesting term that David Snarch kind of developed. And then a little bit on regulating in terms of emotional and couple stuff. Then I'm going to be going into setting up the first session, and then some communication basics. To me, it's the next section, which would be the session 2, is going to go into more of some of the details and expanding on some of these going forward. So remember, complete your feedback forms at each session that you attend. It's crucial for us to be able to get that information so we can upgrade our programs, and that is a requirement for you to do that in order to be able to get your your certification for kind of watching these. And so we're going to be upgrading those processes as we go forward. And then we're archiving the website is being updated so that you can go onto our EPIC website to watch any of the previous training sessions that we have done going forward. Series 1, this is a little bit of the summary. So I'm not going to go over this too much, but just looking at what successful sessions look like, some treating trauma, couples therapy, which is what I'm doing, a little bit into the family therapy, and then there's a Dreamcatcher tour, which is kind of the animal-assisted therapy program that's going forward from here. So yes, take a peek at that. That's our Series 1 versus our Series 2, which goes into the more specialty programs. Little reminder, this is a disclaimer too. Participating in or viewing this session does not qualify you to offer couples counseling. This is an add-on. So if you were watching this as part of EPIC, then you usually have your master's degree and there's already training that you have done with it. Some individuals may be watching this that are not with that same level of training. And so again, these are fine-tuning. These are being aware of some of the important things that I, as a psychologist, critically think that people need to do if they're going to be doing couple counseling. So today we're going to be talking about some intimate topics and asking each of you to apply these concepts to your own relationships if you can. We will be having some time to kind of have some discussions and talk, so I want to encourage that. And in light of this, just keep this in mind. So again, we're all responsible for making this session a safe space. Okay, continuing on. So we're responsible for making this session a safe place. Imperative that everyone is able to feel comfortable in sharing their thoughts. We'll strive to create an environment where everyone feels included, respected, and able to express themselves openly. This includes, again, asking questions. Asking questions also includes, this allows you to gain some more refined skill set and ask those questions that maybe I have missed. Now realize that generations will occur. And this means that I'm going to be talking about patterns that are commonly, but certainly not always seen, and that information presented is backed with some of the research that I've been working with, or even years of experience. So just be aware of that dynamic. I will be using terms that generalize, are based on gender, i.e. masculine and feminine, men and women, as they're commonly used in research. Now, when I talk a little bit later in the process, I'm going to talk a little bit about the continuum of gender and or even sexuality stuff. So I will go, again, if you watch my sex therapy training one, I go a lot more into that because it's a very important and expanded concept. And some things will not apply to you, and that's okay. So again, just realizing that safe space for everyone. So most couple issues are related to, in my experience, communication and micro skills, which is one key area. Intimacy, sexuality, and sensuality is another key area that I see a lot of issues for couples. Breach, betrayal, and trust is another subsection that I'll commonly see. Relational navigation, and that's usually typically looking at navigating the rules, the roles, and those kind of issues. And then parenting. So if individuals or couples have parents, they have parents, but they also have children, it's dealing with that kind of family relationship dynamic, both up with their parents as well as with their children. So things to consider. So for me, working with couples is kind of a next level up competency. Typically, a lot of people will start with your individual couple training, which commonly you can run with one theoretical model and still be effective. As you move into couples requires a whole, to me, level up in terms of skill set. You need to have a few theoretical orientations under your belt. You need to be able to be in a leadership role and be assertive, especially when you're dealing with high conflict cases. Some couples will happily take over the session, be very dominant, or even what I've seen is they will get into arguments, and that argument, if you're being a very passive therapist, kind of be listening to them, they could spend the whole hour arguing and you will not get any movement. And so working with couples requires a balancing of sides. Your job partly is to be able to help navigate, balance, and you may be required to take an objective side or a stance if someone is being inappropriate or being incorrect sometimes. And so the job is to help couples navigate and negotiate with each other through that dynamic. When working with couples, there may be a power differential, not always, and you have to be comfortable working with power differentials, or even what I'll call as perceived power differentials. Some individuals perceive there's a giant power differential and they play what I call wounded ducks. And a wounded duck is where they play wounded, they play hurt, and they're expecting someone to come and protect them and wait for them because of their feelings. And that's one way that some couples or some individuals within a couple relationship dynamic can sabotage the movement or going forward. And I also say watch out for alligator tears. So alligator tears are fake tears. So they're doing it because they want a reaction. And then, if they do cry or have those tears in that response, that people will stop, pay attention to them and not make them uncomfortable or call them on their behavior if it's inappropriate. You may also need to help managing expectations and standards in and around gender and sex stuff. So some people will come in and the common statements that I say is, oh, you need to be a real man, or you need to be kind of following a woman roles. And so these, in some cultures may fit, and this is where part of that cultural dynamic needs to be understood. And so the more you understand about different cultures and their gender and sex roles, that can help you. But sometimes it's about bending those to make them fit and be healthy and appropriate. So it's a challenge sometimes because what people view as standards and expectations may not always be healthy. And any one variable, so this is another key point, one variable in a system can shift, change, or even impact that whole system in the relationship. So the good thing about that is if you as a therapist can go in there and make one slight change, sometimes that one slight change can unplug a whole system of issues that allows things to kind of start to move going forward. And realize that, and I kind of use my gym metaphor, is going to the gym and working with a trainer for 1 hour gets you only so far. You still have to go to the gym and work out to get those results. So home practice is essential in this process. Okay, so going from this, now what I'm going to look at from theoretical models that I want you to be able to understand is there's 6 key methods of couple counseling that I tend to want people to be aware of. You don't have to use them all. It's just know them or know about them, because each of them has something that's important to kind of bring forward to couple counseling dynamics. The first one I'm going to talk about is emotionally focused therapy. So EFT is usually what it's called, and it entails kind of a lot of conversation about deeper meaning of feelings and emotions. And so the concept, when you're working with those, it's really feeling focused. And in my experience, a lot of women, females tend to prefer the EFT dynamic in working with them. There's lots of good validation issues with that. And so it's an important consideration to be aware of that feeling part. It's one of the core dynamics. Imago relationship therapy is another common one that is utilized. And this concentrates on connections between childhood experiences and adult relationships. If you go to an Imago therapist, expect a lot of talking during the sessions and emphasis on listening. So it's just another one to be aware of. I'm not going to go and train you on this or even go too much. I could spend hours just in each one of these. But just be aware of these two, the next two. And a common one is Gottman. So Gottman, the method was created by John and Julie Gottman. And so they focused a lot on the research. And so in terms of looking at what is effective in terms of therapy, and so the approach really, in my experience, has pros and cons. I think it's probably the most well-researched theoretical model and therapeutic process that is out there. It's really good for committed long-term couples who have interests in building trust and continuing the marriage's and the marriage's life. Lots of skill building stuff in there. I think the dynamic, I would say the weakness that I've seen with the Gottman method, and it's not necessarily a weakness, sometimes because they're very structured in how they want you to run it, it's a little bit clunky for some therapists until you kind of do that, until you move it into the art. So what I find, I'll take a lot of the Gottman material because it's really core foundational stuff, and trying to now craft it into an art and not just follow the very structured, but utilize the key important skill sets within that to help where the couples want to go. Lots of times, for instance, the Gottman method is you're going to be doing some questionnaires at the front, and then you might see two individuals individually first before you move to the third session, which would be the couple session, and you're now starting to work on the therapy by about the fourth or fifth session, and some couples just don't have the money for that or the tolerance for that kind of dynamic. Long-term committed relationships who really want to get to know the intricacies of the relationship may thrive on that one. Narrative therapy is number 4. And so narrative couples therapy is a little different, but it looks at helping couples understand the stories they tell themselves and about the relationship, and helping them rewrite or write new stories in their book. So narrative therapy almost reads like your chapter, your book. They've taken it from a book model dynamic. Number 5, solution-focused therapy, or SFT as sometimes it's called. It's very focused on, as its name implies, a means to an end. So it's focused on the problem and finding solutions to the problem in that lens. So it's really good for that short-term therapy where people can get that tangible, hands-on experience and or skill sets to kind of work on much more of a narrow defined problem or set of problems. And the last key one is CBT, or cognitive behavior therapy. And CBT is really about building behavioral skills like communication, problem solving, conflict management, and allowing the couple to remain connected to each other all in that same period of time. So again, for the methods of couple counseling, this is kind of these top 6 that I would typically say are commonly used. And so when you're working with couples, you'll be using, at least in my experience, you'll be using components of each of these to really get a well-balanced couples therapy process. And that takes usually years to kind of integrate them. Okay, so now we're going to get into some good, more controversial topics. So we're going to watch a video. And so the video is called It's Not About the Nail. So I'm not sure how many people have seen this. I use this regularly in my therapeutic process working with couples to help understand some core concepts. And so let's watch the video, and then we're going to have a little discussion, and I want you guys to be able to bring up some thoughts and some reflections regarding what this means, how it may apply to you. or even any problems that you might see with this. So let's zoom to that video.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
It is. Thank you. Ow!
Oh, come on.
Ow.
If you would just...
Don't.
So let's have a little bit of discussion about this. I don't know if we have any sound for this, probably not. So as I was watching, I mean, since I use this quite regularly, I'll do a little bit of talking. So if there are questions in here in terms of the discussion, kind of let me know. And so someone put a nice little note. It's not about the nail, it's about something more insidious. It's it's about stereotypical gender roles that continue to be hammered into our heads, often without our awareness. These stereotypes surface in nearly all aspects of our lives, including in our workplaces. And so that was one person's comment that I noticed. And I think there's actually a whole video on a discussion regarding It's Not About the Nail and that kind of that lens too. So for me, I guess let's have some questions if we have this. And so on the right side of this, these are the things that I want you to consider. Is this a role issue or a gender issue? You know, what are these stereotypes that we're seeing, and are they founded? Because typically when we're looking at stereotypes come from somewhere, you know, and that's different than what we call prejudice or discrimination. Are these stereotypes founded? Where do stereotypes fit in therapy? And, you know, is this looking at efficiency and effectiveness? So before I kind of go into this more, are there any questions that we have from this that we want to kind of play with or have a discussion about? Any questions? No questions? Because then I'm going to be lecturing at you guys. Okay. So I'll go through these a little bit. So in my experience, when we're looking at, is this a role issue, is to some degree, yes. So when I see this, the stereotypes that typically people will bring forward are men tend to be, you know, solution focused. They tend to be, you know, action oriented. They don't want to validate, and they want to kind of just solve the problem. And that my women tend to want to be expressive, be heard, be validated. And so these are some of the common stereotypes, and there's actually some founding to this. There is research supporting a bunch of these general patterns, which I'll talk a little bit about later. And so to me, stereotypes fit in therapy, because if we don't have stereotypes, we can't be really efficient or effective in understanding the possibilities. For me to run through a couple to really get a good understanding of what's going on, if I don't have common patterns of understandings that are commonly related, I'm going to have to do a full thorough assessment, which could take me hours. When I understand stereotypes that commonly occur, I can bring this forward to the clients to say, is this kind of what's happening and what you've experienced? Because I've seen this numerous times. It's not all the time. But when they go, yeah, that's it, or that fits or close to fit, then it allows me to move forward in a much faster and effective way to see how they fit within those stereotypes, rather than just not allowing that to occur. And so my experience when I'm working with clients, what they say about it is they generally love it. Now that doesn't mean they're taking the same side. I've had some clients where they reversed. He is the one that needs the listening and validating dynamic, and she is the solution-focused oriented dynamic when I have a straight couple. If I have gay couples, they're similar. Like the pattern between that gender continuum is just kind of flipped sometimes, but it's still there. Couples tend to date inverse opposite dynamics that complement them. And as a result, if you have two people that are very much alike, you'll get some couples like that. But a lot of times I'm going to get like kind of the inverse opposites to some degree, because they're interesting, they're more exciting, they're new, they're novel, and the foundation of their relationship is more built on their fundamental belief systems and their behavior patterns, i.e. if they're both very committed, then they kind of rely on that as their foundation. So there's another dynamic when we're looking at this is dialectical behavior therapy, DBT, is a treatment mode that involves validation, solution-focused thinking, and moving back and forth. And so for me, one of the interesting dynamics from this is I utilize this video to talk about the two key components that are important when we're looking at my couple work that I commonly do, which is that validation, solution focused dynamic. If we just stick with validation throughout a session, I have someone talking about their perceptions, their belief systems, and if I just focus on validating those perceptions and belief systems, I could be validating something that is very incorrect, in fact, but totally valid and correct based on their perceptions or feelings. I'll finish this statement. If I'm looking at solution focused, then this is about what are we going to do about it if that is the case. And so when we're running some of these dynamics, normally the rule is validate first, then we move to solution focused, and we're going to move back and forth in this process throughout kind of the couple therapy to help the couples explore and express their feelings, be validated, but also then figure out what we're going to do about that. If we just stick with solution focused dynamics, we ignore the validation and people don't feel heard. So since we talked a little bit about that and we saw a video kind of going with the stereotype. So again, the stereotype tends to show some truth to it when we're looking at what the research shows. And so Cohen, even back in 2003, started studying some of this stuff. And so what he's found is that, and we're going to go with biology first. We're going to look at male-female brain. Now, there is an interesting dynamic, and because I'm a sex therapist and a gender specialist, I have to throw this stuff in here because it's partly my fascination, is think of this as a continuum. We have kind of masculinity or male brain dynamics. On one end of the spectrum, we have hyperfeminine or female brains on that other, and then we have the whole continuum that goes in between that. And lots of times you'll see that, and we're all parts of those. So there's very few people on on the extremes ends. All our brains kind of have components. We typically start out in kind of a female dynamic, and then as testosterone gets added to our brains as males, it becomes more masculinized in a bunch of those dynamics and those traits. But some individuals, and I'll say a good example is a lot of my intersex individuals, which statistically speaking occurs about the frequency of someone with red hair. So a lot of people, there's not a lot of that, but most people don't talk about it. Most people don't even know sometimes they have intersex genetics or characteristics because they're hidden, they're internal, and they may not even cause any notable problem. But they might be more in that gray zone where they're at kind of half and half in brain thinking patterns or different components. They could be hyper female in one area and a hyper male in another area, and they're still okay. It's all the mixing and matching. But in order to conceptualize this, I have to now generalize. And so then when you understand the two ends and all the continuum in between, things start to make much more sense. And there's some good books that I tend to recommend to this, like, even though it's kind of a playful dynamic, Why Men Don't Listen When We Can't Read Maps. These are some of the things they do a lot of research. They summarized a lot of the research in terms of the brain mapping and dynamics. So for instance, let's go through some of these typical feminized brain patterns. So feminized brains tend to be largely wired for empathy. They tend to be better at it. They're usually able to show more empathy for others, and they tend to have a greater sensitivity to facial expressions and technically even social nuances. Masculinized brains tend to be better at understanding and building systems, and they tend to be mostly interested in how things work, structure, organization, tasks that require decoding, like map reading. Feminized brains tend to also have a lot better language structures. And so these are just a few of those. I mean, I can go through a whole bunch of them. But as you kind of notice this, not everyone's going to have these traits. I have some guys that are incredible with language writers. But again, these are just some general patterns of what we're talking about. The more you know this, the more things start to make sense when you see common patterns. Because in the office, I see this over and over and over after thousands of times. And I guess I'll share my experience. In my experience, after doing this thousands of times and trying to make sense of everything, it can get very overwhelming. And after I read a few books on understanding bioevolutionary psychology and dynamics in the area of masculinized feminization of brain, I think that first book, Why Men Don't Listen and Women Can't Read Maps, and there's a series of those, they summarize those. There's some language books too, that all of these books, after reading them, really gelled my understanding of why, and things started to make sense that they didn't make sense before, as I was just struggling with it, saying everyone is a unique individual, which they are, and not being able to generalize or understand how these things get packaged within everyone too. And as soon as I was able to do that, it jumped my efficiency and ability to understand what's going on and teach people what is going on and what is more common, because they're expressing, I'm frustrated because I can't do this. It's like, yeah, because that's not typically the skill set that comes with how your brain tends to run. And that makes sense. And so when we look at, for instance, like autism is a good example of that. Is autism commonly has hypermasculine male traits. And so these are some of those common patterns that you'll see within that system. Let's keep moving. And it's not a neat split. And so when we look at that split, and this is kind of, again, some nice little generalizations to at least run in your head, approximately about 17% of men have more of an empathizing brain, or even more of a feminized style of brain patterning. And about 17% women have more of that systemizing brain or masculinized brain. So this is just one of those traits within there, but if we're generalizing, I would say this is probably consistent. I would, off my hip, I was going to go about 80% of the time. My women tend to have more of those women traits and kind of be on that side. And about 20% of the time, it's the other side. They come in and they're very masculinized in a lot of those traits. It's not as common. So just being able to understand these dynamics to help you in your couple relationship systems understanding. Now, I'm also going to talk a little bit about attachment theory, because I think it's really important for you to understand some components of attachment theory. And so attachment theory, when you have couples coming in, individuals with attachment, because this is a relational component, can get triggered. And so I'm just doing a review of attachment theory. I strongly encourage you to go out and really read. There's a good book called Attached, which is a nice simple book on attachment theory that I've referred a lot of my clients to, because it's an easy read and it helps kind of understand. And I'll start with how these are two key components on the grid. So there's avoidance dynamics and anxiety levels. And so when we have secure attachment, they typically have low avoidance and low anxiety. So these are the individuals, and it's about 50% of the population, have a secure attachment pattern. And so for that attachment pattern, these individuals tend to be well grounded if someone is anxious or avoidant, or kind of, they tend to be able to be approachable and or approach circumstances. These are our grounded individuals and don't tend to get flustered too easy in relationship style stuff. As we now move into something like anxious attachment, so these are the individuals that they have a low avoidance, but they have a high anxiety. And so our anxious attachments tend to be the chasers. They tend to need validation. They tend to chase or want to need that dynamic, that relational dynamic. And when they don't have that connection, they feel anxious and they can get triggered. And so when they don't have that connection or that feeling of connection, anxiety goes up. And as the anxiety goes up, they are the chasers. Opposite to that, technically, which would be our avoidant attachment patterns, are low anxiety and high avoidance. So these are the individuals that may want a relationship, but they are more avoidant in that process. And so they don't tend to get flustered unless they feel like they're being trapped, and then they want to avoid to get rid of that uncomfortableness. And so the interesting pattern that you might see in couples therapy is, well, maybe I'll go in that a little bit. I'll talk about the last one, and then I'll talk about some of the interesting patterns that you'll see. The last one is our anxious avoidant. Now, there's lots of different terms that people will see kind of in here. Your secure attachment seems to be the most common one, but there's other names that people have utilized for these, but these are your classic ones. The anxious avoidant attachment tend to have high anxiety and high avoidance. Now, this percentage of the population runs around, I believe, 2%. Your secure attachment's around 50%. And I think your anxious and avoidant running close around 17%, if I'm just kind of going off the hip from what I recollect. Maybe don't quote me on that one, but those are the kind of the numbers. And so your anxious avoidant attachment dynamics commonly look like your borderline personality disorder traits. It's the come here, go away, I love you, I hate you, I can't live without you, I'm going to commit suicide. So there's an anxiety and avoidant pattern that moves back and forth, the push away, the pull away, and it tends to be very disruptive to relationships. Now, when individuals get in relationships with someone, let's say any of these three that get into a relationship with someone who is a secure attachment, they can learn how to become more secure and get grounded. So there's that secure attachment is, if it's strong enough, can shift them over time in that process. However, when you have no one in the relationship with a secure attachment pattern, it gets exciting in session. And commonly, I'm going to say is I'm going to keep my avoidant and my anxious attachment relationship patterns because they're the next most common. If you have two secure individuals in the relationship, I don't tend to see them for couple counseling. If I have some secure with an anxious or secure with avoidant, we're coming in and doing couple therapy, but really I'm now doing more work with the individual with either the anxious or avoidant pattern to help them get healthy, to help address the secure attachment individual's concerns, even though they both might have concerns. But when I have anxious and avoidant attachment, they trigger each other. Anxious attachment individuals need that connectivity, that person, and so what happens is as they pull forward to try to keep someone close to reduce their anxiety, the avoidant attachment individuals run away. And therefore you get, I call it this cat and mouse pattern where, you know, the anxious and attachment individual is chasing after the avoidant attachment individual who keeps running away to go be by himself or go away with his friends because there's that fear of getting too close possible or even getting hurt. And so this just causes a constant flooding for both individuals, leading to conflict. And then the anxious avoidant attachment it's just very disruptive in terms of that pattern. So it's just trying to help them get grounded a lot of the times so that we can start working on the issues. But a lot of the DBT therapy skill sets with working with that anxious avoidant attachment dynamic. But just be aware that that one's the smallest percentage. It's also the hardest to work with because they're pushing and pulling, and it's also very just generally disruptive. But a few little things to be aware of. We call it triggering, or it causes a flooding, and Gottman talks a little bit about flooding stuff, and I'll do that a little bit later. But as individuals get triggered, they get flooded, and that flooding causes their heart rate to go up, and they kind of go into almost like a trauma response. We're flooding in that system. So again, a little bit more on some attachment theory stuff. So again, they tend to like intimate, more durable, they tend to be happy relationships, and they tend to have mutual trust in terms of that process. Or they're a lot more trusting because they're not so triggered. Again, other words here, this would be our dismissing, and this would be your avoidant, avoid intimate relationships to protect themselves from rejection. The fearful avoidant, which would be your borderline kind of traits. They view themselves unlovable, so they avoid close relationships due to fear of rejections, but they also kind of will come in back and forth because they still want it. They just don't know how to hold on to it. And then the last one is anxious. And so that's striving for self-acceptance by gaining acceptance and being valued by others. And therefore, they tend to be more externally validated and those patterns. Now, interestingly, I'm going to generalize again just to let you be aware. When I'm looking at, although the book, for instance, some of the research tends to support that they said the anxious and avoidant patterns are equal in society. In my experience in the office, no. In my experience in the office, I'll see a lot more highly anxious individuals are more females or women, and my avoidant patterns tend to be more seen with my male clients. My women are a lot more likely to kind of engage in the relationship and try to kind of do that. And my guys tend to want to run away and get flooded a lot easier. And so this starts to make sense when you talk about Gottman stuff, which I'll talk a little bit later about weaknesses in kind of gender and sex profiles for relationships. So here are a few little interesting sex and gender differences. So this is on a continuum, and these are not excuses. So I don't want people to use them as such, but they are present. And I have some people, I've seen couples where they will say that the other person's using this as an excuse. And I'll give you some nice playful examples after I kind of go through some of this. So here's some interesting research supports. So social nuances. So there's interesting support for masculinized brains picking up only about 40% of the nuances compared to more feminized brains, which running a lot higher. So when I'm looking at couples in a relationship, and this is probably the best example, many of my women who come into session who can see the social nuances and read into that, and sometimes we have more assumptions in that system, but they're able to be more nuanced to picking off what's going on in that dynamic, and they're expecting their partners, who may be male, to pick off that same level of them, and my male partners are not seeing it. They're not able to pick it off, and therefore they're just saying you just can't see it. It's just an excuse, you don't want to see it. And so they're making assumptions on what the other person can't see when they technically really can't see it. And so that's another dynamic. And so interestingly, I'll say my male brains are not as relationally skill sets as my female brains tend to be overall. And this is another dynamic, alexithymia. So these are all my male weaknesses, I'll call them, for relationships. Males tend to have better skill sets in other areas. So alexithymia, this is the ability to put feelings into words. And interestingly, this is a common issue with males. They have a harder time being able to identify what's going on in some from a feeling perspective. That's why they tend to move into more cognitive patterns and then have and express those into words. So there is a term for this. If you see that in session, be aware. It's not uncommon. I had to learn this because when I was doing my training, I was having one of these issues going, I know this ain't making sense to me. In fact, I can even share that as when I was first asked by a therapist, like, how are you feeling? I had no concept really what he was asking. And so in that dynamic, I said, what do you mean? Feeling about what? I need a context. I need to kind of, I could not just go to how are you generally feeling right now? Because there's too many factors in my head, as I'm very heady. And so once we could focus on that, then I was able to kind of get down that lane. And I use feeling sheets with my guys, and more women too. But when I have individuals who are not able to put feelings into words, I will bring up my feeling sheets. So maybe that could be one of the handouts we could play with, and we can add onto our list. I have 2 sets of feeling sheets that I use, one with faces and one with words, just to be able to kind of pick off a really good nuanced feeling if they're not able to identify it. Flooding. So Gottman studied male and female relationships in his couples, and what found is that men tend to be more common in a flooding response when they are in with a partner who is female, who does not trust them. And women don't seem to have that same response. And so, and flooding is basically when your heart rate goes to 100 beats per minute and you're not exercising, just due to a social relational kind of issue. Once your heart rate hits 100 beats per minute, I'm expecting them to now be flooded, not think clearly, not be able to put things into words. And again, it's much, much more common with males than women. You'll also see this with individuals with a trauma history. So the trauma history will look like that same floody response. When you see couples or someone that looks like they have, deer in the headlights kind of look, they could be in a floody response and doing a freeze response versus fight or flight. There's a fourth one commonly we call fawning. So that's that trying to just get close and nurture and try to, fawn to self-protect in that system too. I'm going to talk a little bit about language patterns because language patterns are another common pattern I'll see in couple dynamics that I want you as a good therapist to really look at and know. And I would hope that they train a lot of the stuff in my undergrad or in my grad programs, but I realized that when I'm training a lot of my students and even provisionals that no one's even heard about this and they have not been trained in school. And this is core stuff for me. So also look at about a focus. So again, some gender stuff. Relational oriented dynamic versus inanimate focus. So again, this is, focusing on feelings and relationships and family dynamics versus inanimate focus, or, getting a task done and getting results and kind of getting that hands-on focus. You'll see this from a gender perspective or a sex perspective. Okay, I'm going to go to the last one here on rates of mental illness. So when you're looking at gender differences as well, be aware that there are some differences in rates of mental illness, diagnosed or undiagnosed, in all areas. So for instance, men tend to have higher rates of depression, women tend to have higher rates of anxiety. Learning disorders, I believe, are more commonly seen with men. ADHD, I think it's a little higher in men because it's also similar with one of the common traits of the quad or quintad of the autism spectrum. Autism spectrum is a lot more seen with, it's more diagnosed with men and males because it's easier to identify and see. Borderline personality disorder dynamics, I believe, is a lot more common with my women. Antisocial personality disorder is more common with my men. Narcissism, I believe, more with male dynamics. So again, that doesn't mean it's always, and that's the dynamic. It's just statistically speaking more common in those genders. We have strengths, we have weaknesses, we all fit within these systems. Be aware of those patterns, put it in your back pocket, and make sure that each client that you're dealing with, that you're paying attention to, who they are, the unique dynamic of how they run, but just realize that there's a higher likelihood dynamic that they may have some of these issues if you're going to be working with them. And they may be impacting those relationships. On the bottom of this page is a little link for you, and it's a brain wiring test. So now, an anthropologist historically did a test, and this is the one that I will use to help you look at it. It's actually a fun test. And so the test explores your brain wiring from a masculinized to a feminized prospect, which goes down, I believe it goes down to -40 to 300 with a 150 split, which means if you score on this playful test, it's not really too playful because there's some validity to it as from an anthropologist lens. And so the lower your score, the more masculinized brain you tend to be. That doesn't mean you don't have any high feminine traits, it's your overall score. And so when I've seen this, and it's kind of a funny process, I've worked with individuals where you can almost tell me your job or as you start seeing patterns erupt in systems, you can start make educated guesses really quickly. And I remember, guy come in and we were playing with this and they were having this issue because they couldn't understand each other's perspectives because they were trying to think that everyone thinks like them, which is what we tend to like to do. So I kind of gave the test so that they could understand. And so we had a -40. That's the lowest I've seen, which I think he bottomed out on that test, -40. And he was married to a woman who was in her high 200s, like 280, 290. So this is where you get that extreme difference in terms of brain dynamics. And I asked him, let me guess, engineer, computer science. He's like, I'm an engineer. How'd you know that? Because my engineers tend to, and my computer scientists and or my accountants tend to run much, much lower on that continuum. And I believe she was a teacher. And so you get into this social, relational, dynamic, abstract thinking and more in that component. And so when you understand those, either the number playfully or their job, this is how they tend to think. They're good at thinking in this pattern, and you got to be able to work within their skill set while training them to kind of cross-train out to be able to work with their partner. So yeah, if you're out about 150, then you got a balanced brain between both of those areas overall. Doesn't mean you might not have a weakness somewhere in there for something. You can't be good at everything. So, playing with language patterns. So, the other dynamics that you'll see, and I'm going to generalize some of these, and this is from a linguist who kind of played with this. And so, commonly, we're going to look at, again, more of my language patterns from a gender and sex perspective, superlatives. Normally, I like to ask people, who do you think does more superlatives? What are superlatives? Superlatives are your extremes. Always, never. Those are your two kind of, it's the extremes of that system. Action or, so, and interestingly, so women tend to have speak more superlatives in their system. And so when we're dealing with couples relationships, and I'll say as action-oriented tends to be more my guys, my male-oriented dynamics. And so when you have that plus a more semantic thinking process, and so semantic means, and again, this is more commonly seen with my male perspectives, and this kind of leads to one of those little case studies. A semantic dynamic, if someone comes and says, you always do this, kind of like we watched in It's Not About the Nail, technically I have a lot of my hyper-semantic thinking males go, but that's not technically correct because I was able to do that once and it's not always. And so technically, although he may be correct, she's not feeling validated by her feelings from that system, and now we have conflict. And so part of the therapist's jobs is to be able to navigate language patterns to get them to speak, well, I mean, this is what I will do, to get them to speak more clearly and critically regarding what they're saying, because what they're saying may not be actually true. And if we're not working with a true statement, it's going to cause some problems. So I have to validate the feelings, but then change the language patterns to be correct. Assumptive thinking. And so again, these have strengths and weaknesses all within the system. Assumptive thinking is more commonly done by women. The advantage of that is they're able to pick off possibilities, kind of from a risk dynamic. They're able to put things together and kind of make assumptions to see what's going to happen next. So they tend to be much better at gauging what the next patterns and almost anticipating other individuals' needs. And from a bioevolutionary lens and relationship focus, this is a wonderful, important skill. The issue, though, is when it starts to get higher up on that continuum, I'll have couples, and this is where we have commonly issues in the couple therapy dynamic, is they're using almost exclusive assumptive thinking, and they don't allow their partner to even have comments or make statements because they're making an assumption based on their nonverbal language of what they're thinking, what they're feeling, what they're doing, what they're going to do next, and they will run in that system and view it as fact without respecting the other individuals even to be able to answer that question. And so this is where a common pattern I will see within couple dynamics, or that emotional reasoning. So and again, these are common patterns that I'll see over and over, and I want you to be able to learn how to work with these. And I'm just touching on these and try to kind of help, massage some of them out. The emotional reasoning sounds like, well, this is what I feel, therefore what it's true. And the emotional reasoning is commonly added to the assumptive thinking. So for instance, I'll pick a case in my history. So I had a couple working in my office, and they were a high conflict couple. And so we looked at labels and assumptive thinking and emotional reasoning. And so what happened is the couple were talking, and the guy raised his eyebrow, and he went kind of like, really? And the response back from her is, you're being abusive to me. You're assuming that, you think that I'm the crazy ass bitch and this is what's going on, and kind of lashed into him because of the eyebrow raising. And technically, he didn't do anything wrong. I mean, I can expect the process to get a little bit of kickback. But what led from that raising of the eyebrows led to an assumptive thinking and emotional reasoning and she was arguing with me that her perceptions were correct, that he does not like her, that he is thinking she's crazy, and she's starting to support that process from the irrational dynamic. But she was arguing with me about her being right, and no matter what I would say or even he said was wrong and or either genderist or kind of that lens. And so it became a really hard time to ground her in that responding pattern, because she didn't bother asking him what's going on with the raised eyebrows to allow him to be accountable for his own behavior. So when you're working with these patterns of couple work, I really want you to volley and hold people accountable to their behaviors without making any of these assumptions. And if emotional reasoning is occurring, we need to verify it and check it so that it is actual reasoning that's based on information going. And that doesn't mean the other party is telling the truth, but if not, and they're being able to pick off some of that, something's not lining up, which you might as a therapist also see, we got to recycle this again a few times to massage it out to see what's going on and do that. Another common dynamic, and you'll see this with your, again, this is anxious attachment dynamics. Again, and since that's the case, women tend to be doing this more, is personalization of statements, which means taking something that someone might say as a personal attack versus just a statement of fact or a statement of perception. I'm trying to think of some examples of, hey, I want to go out to, it could be simple as I want to go out to Mexico tonight. It's what, you don't like my cooking? So that statement that is related, indirectly it's related to possibly her cooking, but it wasn't explicitly stated, but it's an assumption that, in a negative way even, that it's a personal attack on you not wanting to eat my cooking at home. So these are some of those examples of emotional reasoning and personalization of statements. Playfully speaking, the number of words spoken to explain things. Also, I think it's 20,000 words on average that women will speak per day compared to on average 7,000 words by men. And that could be based on the jobs they're doing as well, but it's just interesting little research to kind of play with that. A little bit of support, again, that emotion-based versus thought-based speech. Even when you listen to couples speak, I want you to be able to listen to what they're saying, Are they mixing them up? And again, I'll go that when we go later on in terms of the communication patterns. But, I feel that you're having an affair. Is that, and then coming back with a statement, well, that's how I'm feeling, and therefore my feelings are valid, and they're truth. And they could be a truth to you, but it doesn't mean that person is actually having an affair. So this is where that feeling is really, I'm feeling jealous. Feelings always are one word versus a perception or a thought, which could be now much more, versus an action, which is actually doing something. And therefore, playing with this in terms of language patterns to understand what is talked about, the details, and then kind of understand relationship and summary points. So your job is to go through this, identify the issues, identify the relationship patterns, and then summarize some of these points. Some people may just want to summarize an issue rather than get into the details. Some people need the details, and they actually never summarize it because they get caught in the details. So there's so many nuances. When you're adding a couple relationship dynamic, the complexity goes kind of a geometric sequence compared to your individual therapy work, in my experience. Because you have to now do a his, hers, and ours relationship pattern dynamic. So there's three things you're looking at in a two-person couple versus kind of the one. And even though there's stuff that might be related to them outside of that, you're just working with one person. So I'm going to talk a little bit about Gottman's research summary. I encourage you all to kind of get the Gottman training. There's level 1 and level 2 dynamics. And so because this is the most researched process, I encourage everyone to look at that and then harvest what makes sense with you as you go through this process. Again, they have a structured process to work, and you might want to follow that. It's okay for some individuals, not so okay for others. So Earlier, I discussed flooding. Gottman was the key person that found out about flooding and men's emotional response to these dynamics. Bonding and intimacy, he talked about this. And so bonding and intimacy is another little interesting stuff. And when we look at people, when we touch individuals, when we even talk, and we call it there's oxytocin release. Oxytocin is our bonding chemical. And male and females respond differently to oxytocin dynamics, interestingly, even too. So for instance, eye contact releases oxytocin more in women than it does tend to in men. With touch, I think they're about the same from my recollections. Kissing, women tend to have a higher level of oxytocin release compared to men. And so we get these little interesting patterns on how does it make sense in terms of what people are doing and that release. An orgasm release oxytocin. It releases a whole bunch of other stuff too, but I'll save that one for my sex therapy process. You can watch that one for me where I go a lot more into the detail on this. But just these are the components. Communicating, talking, just being heard releases oxytocin more in women than in men. And so when we're wondering who tends to bond more and why, there is some realize that biological component, even a bioevolutionary component, because we run on that biopsychosocial model. Hugging, being listened to, being talked to, all of that stuff leads to oxytocin, which leads to bonding. And again, there are gender differences. Now, on the right side, we have what's called the sound house model. So if you haven't done the Gottman training, I'll cover a little bit of the sound house model for you right now. This you can find kind of online. It's quite common, and it's called a sound relationship house. And so typically, in summary, a relationship is built with trust and commitment as the core walls holding everything together, and building the love maps. Love maps, according to Gottman, are kind of knowing the other person's world wishes and what's kind of going on, what they want to do. And while you're doing that, that's kind of your map going forward. And as you do that, the key things that are supported in research that are most problematic is sharing fondness and admiration, turning towards each other instead of turning away, taking a positive perspective right off the bat in terms of, it could be solution focused, but it's kind of being a supportive, positive lens coming into the communication. Managing conflict. Now, conflict is not the problem in the relationship when I'm doing couples want to argue and they can argue in a healthy way. Great. Couple conflict is what's required commonly for growth to occur. But this is about learning how to accept your partner's influence, have a dialogue about the problems that are going on, and being able to practice self-soothing or even soothing the other individual in this conflict dynamic to be able to move forward and through. The issue for me is I want to know how couples manage their conflict, resolve that conflict, and not be abusive in that conflict. As you do this, you move higher on that house, and that allows you to make your life dreams come true, and then ultimately you create that shared meaning going forward, which solidifies that whole system, and that's what's called the sound house relationship model. A little bit more in Gottman too, and these are the things to be aware of, and this is kind of the 4 horsemen of the apocalypse of relationships. When he did research, he found that these 4 key components are the most critical dynamics to understand how relationships last and to predict the breakup of a relationship. So the first one is criticism. And this is typically verbally attacking the personality or character of individual. Contempt is number 2. And this is the attacking that sense of self with an intent to insult or abuse. And so commonly this doesn't even have to be verbally. This could be just non-verbally in terms of that contemptuous action. That's the, I'm not going to talk to you anymore because, you know, you're not making sense or I don't care about it. Defensiveness, so victimizing yourself to ward off that perceived attack and reverse the blame. And the last one is stonewalling. And stonewalling is that withdrawal to avoid the conflict and convey disapproval, distance, or separation. Now, stonewalling is not the same as taking a break. I have some people coming in going, oh, I need to take a break right now or a time out. Oh, you're stonewalling. You don't want to talk to me right now because I want to talk about it right now. I got to get it done out. And so this is where you get into that unhealthy, I need you to take care and deal with what I want right now immediately, and not allowing individuals to take a break to help manage their own emotional responses, which usually causes this flooding response, which causes your fight or flight, which means you want to talk right now, you're not allowing someone to take a break to come back in a short period of time, to kind of continue on where we left off. You're caging a tiger or cornering a tiger, be prepared for a potential fight or a flight, or even that freeze response. Those are your most common patterns. And so these are common patterns we'll see in your relationship with couples. So how do we deal with criticism? There's that gentle startup, and you're likely going to have to model that in those sessions to be able to talk about your feelings, use those I statements, and express that in a positive mindset by asking positive framed questions, lead them in that pattern, ask them to ask each other questions. And again, I'll get to the nuances of how to ask these good questions later on. To counteract your contempt, we're building that culture of appreciation. So remind yourself, your partner, of the positive qualities, find gratitude for positive actions. That's something you can do either during and the beginning as the warm-up, or at the end to say, we're able to work through a bunch of these stuff. This is incredible, and I'm appreciating my clients for being able to sit through the uncomfortableness to help work through some of these components. To help with that defensiveness, I need people to take responsibility for their actions. And you, as that therapist, might have to hold people accountable for their behavior in session, or model it in that session to help let them learn from you in this system. So that's accepting the partner's perspective. You might have to stop someone from talking who might be dominating that talking to allow for what's going on, or to hold them accountable for abusive or inappropriate behavior in a appreciation or a gentle startup way to help move that along, to let them take responsibility for their actions or inappropriateness, or even take responsibility by acknowledging or identifying what's going on in them if they are freezing or wanting to distance. Just what's going on is sometimes the easy ask the question. In session for the stonewalling, then we're looking at that physiological self-soothing. And this may require you taking breaks in session, or spending times on doing something to soothe and cool them down, or even distracting a little bit to kind of help them pace throughout this process so they don't flood, so they don't want to avoid and go away. And for you teaching the clients to help learn about that self-soothing is important. And I'll talk a little bit more about self-soothing later through this process. Any questions from this process? Are we still good? Okay. So now another one that's a common pattern that I'll see is what's called normal marital sadism. And so the late David Snarch developed this, and I kind of laugh because there are common patterns. So I'll kind of go through this and try to explain it, because there's a misbelief that everyone is supposed to have this happy, Disneyland kind of relationship pattern. And it's not realistic, and everyone's going to have different patterns. So in this case, I'm going to read this out. So case in point, so countless couples who torture each other in ways large and small. And if you're going to torture your mate, the sex seems to be one of the most popular ways to do it, whether it's by the partner who wants it or the partner who doesn't want sex at all. So this is the foundation where David Snarch kind of developed what's called normal marital sadism, and it's a common term referring to the emotional mayhem that occurs far more frequently than most people are willing to report, than reportable acts of domestic violence, because it's not hitting that level. And there's different types of, I'll call it normal marital sadism. Some of it can be, kind of abusive, where they're kind of complaining about something that they're not getting, for instance, on sex. But there's also, I'll call it the playful dynamic of normal marital sadism, which is that teasing or playful tormenting in a system. And so both of those technically fall under that normal marital sadism. It is very common to say that it's not present, in terms of the numbers, is just kind of like really, really a falsity. So in this case, and he talked to another case, so I'll read this out aloud. At one workshop, a female therapist told me she hadn't had sex with her husband in 5 years, And with obvious disdain, she said that she had no intention of changing. When he asked her how she planned to handle the disparity between her personal and professional lives when she herself was a therapist treating couples' desire problems, she demanded to know what I meant. What about empathy for your husband in this context? I asked. David Snarch did. He said, you're an attachment therapist. Is this supposed to make him feel safe, secure, and valued in terms of this lens? And again, so my marriage is none of my client's business, she haughtily replied in terms of to David Snarch in this context. And so when we're looking at our own relationships on how they might play in this, are you leading by example? Are you able to kind of identify some of your own issues and stuff within the system? Although I would say as the issue here is not that she didn't have sex with him for me in that 5 years. My question was the disdain, the intention of not changing, and what that meant. Was this a punishment? Was this what was going on underlying this in terms of intimacy, non-sexual? And so when you're having an attachment therapist talking about attachment therapy and telling everyone to do that something, but she is not willing to explore her own relationship and what's going on with her to experience it and or even look at the intimacy patterns, we're going to have now a problem. And again, this is quite interestingly normal and common, even if it is problematic. Here's another little case, because it's just, I want you to be aware of these nuances in terms of what can happen. Another case, a therapist and his wife who consulted me for marital problems. The man described himself as a holding therapist, meaning that a significant part of his therapy involves having partners hold each other to establish safety and attachment and security. As they delved into their marriage, his wife said she felt sexually inadequate. When he asked how this came to be, she said her husband frequently had sexual affairs with other women, but refused to have sex with her. She indicated that she was eager to have sex and was capable of being good and bad. And then when he asked why they didn't have sex with his wife, the husband laughed and said, that's a very good question. So again, looking at your own patterns of behavior, what was the cause of this? Helping understand, is this tormenting her? What's the underlying pattern? It is a common pattern of indirect or passive aggressive dynamics coming out. And so David Snarch in this process is looking through even therapists and their issues are showing within a couple system. So final one kind of here. So he was treating his wife cruelty, torturing her with sex while encouraging other couples to make each other feel safe and secure. Although it's heresy to suggest that a therapist's marriage should be his or her client's business. Therapists can be relied upon to have better relationships or can't be relied to have better relationships than their clients do. So we're trying to help support not only you learning through this process and having a better relationships, and you might have to now experiment and experience some of these issues. But if you don't know about them, you can't work with them. Now again, another normal marital sadism concept that I mentioned is that playful tormenting of the other partner to feed off their emotions. For example, making them squirm or teasing them, commonly more seen by men. But it's not meant to actually hurt. It's just meant to kind of playfully make someone uncomfortable, but not too uncomfortable. And so some couples are okay with that. Some couples, or some may not be, or some partners may not be fully okay with that. So it's just aware now you're having to navigate, is this a problematic behavior? It might not technically be a problematic behavior overall from a clinical lens, but it might be from a relational lens. They are different. So when working with couples exhibiting some of this sadistic behavior, so I need you to be in charge. So this is about therapist needs to be in charge and therapist needs to manage the session. You should always be in charge, but allowing the clients to help guide and navigate what they need from you. So we have some of these components is to help some clients cool. We have what's called ice pack therapy. And so And this comes from DBT model. And so ice pack therapy is basically the vagus nerve tends to get very flooded in that response. So you can actually use ice packs. So in your therapy practice, you can have those little gel packs in the fridge. So if someone needs to utilize them because they're not good at managing their emotional response, you can put it on their face, their forehead, their neck, to be able to cool that vagus nerve, and that vagus nerve response comes down. Their heart rate starts to go down, and they start becoming a lot more rational, reasonable, and grounded in that system. So it's also validating some of their feelings that's going on, and even if what is the underlying intent. Teaching some things like cyclical breathing or belly breathing or timeout training are some of the other key things to be aware of, so that you can have the client's pace. You don't have to sit here always for an hour, hour and a half. I've had some couples say, we need to sit down and work on this, and we have to work on this till it's fixed. And they could sit there for 3 or 4 hours, and you've overwhelmed one individual commonly. The other person can go all night. And so they're not pacing, they're not breaking cyclically enough to allow that marathon of communication to occur. And some things may not be fixed in one night. Commonly they won't. They need, numerous sessions to slowly work out, process, understand, or even make amends too. And so that's bringing that back. And then a lot of times when we're looking at that sadism, that tormenting dynamic, teaching someone that it's not about you and not hooking and biting into each other. And that's a playful kind of dynamic. If someone baits you, it's, people tend to get baited and then they bite and then they kind of argue about it and it gets distracting. And some people and clients will use that to distract them from being the center of attention or talking about a topic that, is important, that they know is important too, but they don't want to be called onto it. So they will do that dynamic or change directions or blame. There's lots of strategies that clients will do to get you as a therapist or the other partner to not focus on the issue that is a matter. Now, to help understand what, when people are hitting that flooding, we have what's called oximeters. And so oximeters, we don't have a picture of those. You can look them up. They're little black kind of boxes that kind of go on your finger, and that will track not only your oxygen later, but your heart rate. It's an easy, some of the new phone, iPhone watches or some of the watches for exercising have oximeters built naturally into them. Not oximeters, but some may. They'll have your heart rate monitors tracking into them, so you can actually just see where their heart rate is throughout the session and kind of when they go. Now, be aware there's one little qualifier to this. High performance athletes, so normal individuals, when they get stressed and start to flood, their heart rate goes up. And so when you're sitting here, your heart rate should be around 60 on average. So when you're sitting with someone and arguing or talking, or even, you don't even have to talk, they just have to emotionally remember something and be flooded. That once it passes 100, you're in a flooded response. High performance athletes, because their body is trained to deal with stress in a different way, their heart rate actually goes down. So they can actually lose in that system more. And so just be aware of that possibility if you're working with someone who is high performance athlete and you're tracking that and watching their heart rate go down. I think I've had someone go down to 40 in a session with a couple because they're like, and that would be, you're starting to now get dizzy from the other way. And that might be a good stop for us to have a break. So now that we're back, options for the first session. So there's different models, so people can there's no right or wrong in this. And so depending on who you talk to and who you're being taught by, in my lens, I'm giving you my perspective of doing this for, 30 years. Almost 30 years now coming up. And so, so you have an option of seeing them for 1 hour each prior to couples session. Problem with that is it's really not cost effective, but some couples want to do that because they want their whole side. They need to talk, they need to be validated. You come in, you get both sides. The problem with that is also you might not get to see what their goals are as a couple. So it's just, I let the couples lead that, And so I'll usually tell the front, is either I'm like, I can run as well as however you want. You want to come in for individually, and then just make sure that you let us know that it's a couple session, not an individual session, so that I know we can plan for this. I've had couples come in where they booked an individual session with me, and then a month and a half later, the other couple side books another, and they have 2 different last names, and they're talking to me like I'm supposed to know their partner, but there's no identification, there's no connection, and I'm like, I have no clue who you're talking about, and if I did, I don't even have consent because you didn't let anyone know we're actually doing couple therapy in the system. So it's like, and then I'm stuck. So it's like, okay, if they are present, if they are your partner, I can't talk about him, and therefore all I can do is listen to you and kind of gather your dynamic. So I like to have that set up right on front, and it's couple session. If you're going to come individually, fine. You can see them together for the whole session. That's commonly what I do. Now, in the beginning, I think I used to do some mixing and matching, and depending on the circumstance. But because that first session, I'm gathering a whole bunch of information. I'm just good at taking the lead more as I've gotten experience. So I'm going to dictate what's going to happen so that we kind of get what they need to be stated, get my goals set up on that first session, get the background history that I need to kind of make sense of what we're going to be working on, and either start working in that first session, which I may, because some couples will come in with a very focused issue or question. I don't need to spend a whole hour or 3 hours prepping to answer this, straightforward, focused question. Some come in, they don't know what they need and what they want, and so now I gotta really kind of massage and work through what's going on in their heads and what's, all the issues that they might have. And some need to vent to kind of just get it out there before we get into session. So these are all those little things just to be aware of. You can also have them see each other for 1.5 session. So sometimes one client will say, I'm not able to talk to my partner right now. And you'll see this more with your domestic violence cases or high conflict, unresolved issues, stuff like that. So they want to say, can we split this up into half sessions just so that we can each say our sides and then kind of go from there? And I said, oh, sure, that's no problem. I just want them to know I need to just be aware of that process on the front end so that I'm giving good customer service with them later on. Last possible dynamic is you split it up into a third, which is I'll see you either in the beginning or the end. I'll see you in the beginning for like a bit, or I might say, I'll see you a little bit, 20 minutes, you 20 minutes, and the last 15, 20 minutes, I'm seeing you guys together to summarize the key points that we're going to be working on together, clarify it, and make sure I'm going to be going with that so I know what I'm doing going forward for next session. And I give homework. I always give homework in terms of my goals and what they want or what they're going to bring in next time so that there's always that movement forward. The way I do my notes, and again, process, when I'm doing my intake, I will always have my goals set on the side on my front page so that I know the key things that I'm going to be working on. And if they come in, I'm never going to ask, so what are we working on today? Because I don't have a clue. I'm going to say, is there any update that we're going to be working on that I need to be aware of? This is what I gave you for homework last time. What's the homework? Are there any new goals that we want to add to this or sidetrack temporarily? And so I will always, I never have, until we're close to end of therapy, with them overall, I always have issues to work on, be it skill building, be it exploring, be it working on the goals, doing the stuff in session with them that they seem to not be willing or able to do at home by themselves, asking questions. There's lots of stuff. But it's also a framework that you do when you're setting it up on that first session going forward, so that you're being active or proactive and that I'm getting that movement that I want for couples. So regardless of whatever option you choose for the first session, be sure to explore options for consent and how they may interact later. So for instance, by that end of that first session, I want to know what they want to accomplish in counseling. Possibly, unless we did all the stuff in the first session, I have homework for them to complete for the next session. And sometimes that could be the Gottman's checklist for complex sessions if they want to do that. I'll inform them. And so there's, I don't know if we can probably put that one online as another little link near the end, is the Gottman has they pay for it online, but you can, as a therapist, can get a link to this, I think, once you've done the training. And so therefore, you can send them the link, they pay for the link, they have your email in there, and you get back the results of their testing for how they're matching within the couple's checklist. But consent also means if they're going to come in as a couple, I may not talk about everything, but I have the freedom to talk about everything. So that's the difference between me bringing a therapist, like a couple in, and it's really one individual and they brought their partner in as a guest. They just get their guest. We have a consent form for guest, which means they can come in, they're entitled to it, they've been informed of all the consent dynamics. It's not their file. And their information is just kept within that. If it's an individual therapist that they come in and then they want to move to couple, I can't move back in the same way because they come in as individually and they might now bring in their partner and now they want to work with me as a couple. Their information is no longer confidential. So if they're going to go out and have a fair or talk about that will likely be brought up in terms of the session because if it's impacting the relationship, I'm not going to be the holder of the secret because they want me to. Go to another therapist for your couple stuff to let them know that. My job is to work for the best interest of the couple once that moves to couple therapy. And so I'm very clear and explicit in terms of that process. Once you go from individual to couple, you can't go back to individual unless they've separated, and then it gets a bit more tricky. So again, be specific in this process. So what do they want to accomplish in the session? And so this may start out with hearing both sides. They may have both different particular issues or focuses. And when they say they just want a better relationship, they might actually mean that they want to, and here's some common issues. Then this is where sometimes being vague is nice and easy, but it doesn't get you good results because I need to know what that really means. Someone wants a wish and they say, I want some good stuff. I don't know what good stuff is. I need it explicit, like, I want to go to Mexico for 1 week by the time, before next year, and I want to do these activities there. That's a level of explicitness I want them to be when we're working on here. If it's becoming better at communication, that's a decent start, but then I got to break that down into say, where are the issues? Are we just practicing your basics? Because, lots of times some of them are okay with communication. They're getting stuck at a certain point. So I need to know what's the sticking point. Is it breach repair? Someone breached a repair. Someone had an affair. Someone lied. Then I need to look at breach repair for that particular issue. That's nice and clear. Sometimes they come in because they have mental health issues. One may have BPD and their partner is grounded, and now we're like, okay, this ain't working smoothly, and we don't get it. What's going on? So then I'm going in and doing education. I'm talking about, do they have any previous diagnoses? If not, I might have to do a diagnosis in session by gathering enough information that says, yeah, this looks like it. I may do a formal diagnosis. I may do an informal diagnosis just to let them go. It depends on what's in the benefit for them first. And so I might teach, if this is what's happening, because it really sounds like it, here are the things you need to be aware of so that you can now move forward and come back and then I can work with that. Another common one is learning to have and enforce stronger boundaries. Yes, no, maybe, that may be so. How do we clarify? How do we enforce? How do we hold accountable? What are boundaries? What can you say no to or yes to? What is fair and reasonable? We spend a lot of time helping people understand boundaries, enforcing boundaries, be it with their kids, be it with their parents, family members, or even with their partner. And again, to me, every one of these can be now broken down into sub-areas, which then can be broken down into sub-areas depending on the level of knowledge you have within each of those areas, right? And so, again, I'll talk a little bit more about these later, but there's just so many variables as you get through this process. It can become overwhelming, kind of like the Dunning-Kruger effect. You think you might know a lot, and then you realize how little you know until you've done this for a bunch of years. Could be learning to have a better follow-through. Like this could be due to ADHD. This could be just consistency. This is, trust building. It's again, just what would they want it to look like if it was to be the way they want it to look like, and have them be able to identify that and as clear as possible on the outset. The clearer they are with those goals, the better they have a chance of helping them accomplish it. Have someone mediate their discussions. Sometimes that's my role. They're okay at having discussions, but they get stuck in an area. They need my perspective on, is it fair and reasonable, or what's causing this problem? I just had a couple just last week where they're good at communication, but they're not always good at seeing what might be missing in that process. And in this dynamic, it was purely the fact of how someone was engaging in the process. They weren't asking questions, or they weren't asking the good questions. They were asking questions as an accusatory dynamic, which was putting the other person on defense, and they weren't able to answer it the way the question was worded because they're very semantically thinking. And so in 2 minutes, I mean, they kind of laughed at the end. I just had the one client, in this case is a female, instead of keep asking me the question, she never bothered asking him, ask him the question using some of the rules that I'll go over with you, which is pretty simple and straightforward, and wait for his response without making assumptions and personalizing in the whole system. Soon as she was able to do that and or make a proposal, their issue was resolved in under a minute. They spent 2 weeks arguing, waiting to get into me because it was stuck. So it's partly that fine refinement that you can start to see where the issues are quickly, because you kind of start to see this over and over in generalized, patterns of behavior. And so once I kind of, I think, let me guess what's going on, try this, and all of a sudden, ta-da, I was done. I was like, that was it? I was like, that's really it. It wasn't that hard. But they couldn't think through that way, and that's why they said, that's why we come to you. If you're going to be dealing with couples, with kids, then I really encourage you to take a parenting course. And there's some free ones, they're not that good. Or at least read some good parenting books to understand developmental dynamics, because you have, usually your master's program, you're going to have at least some developmental courses, but a good parenting course or a good parenting book to understand how to work with children teaches you a whole bunch of basic skills that helps you deal with everyone in terms of behavior management strategies, positive and negative reinforcement, punishment dynamics, holding boundaries, consequences, communication. Like, there's all those little micro skills are really important for every relationship. Even though it looks like it's for kids, it's common. And then again, it could be just learning about a particular topic together. For me, it's lots of time it's sex therapy. So they come in, the really issue is they just want to learn and kind of make things better. It's not really problematic. They want to make things better and kind of keep moving forward or maintenance and kind of get some third-party perspective. But I want that written down in my first session so that I know what I can work on, or at least have my goal setting, my plan in place so that I can move forward next session as soon as they come in. And I don't waste kind of time when they come in. I'm pretty in there pretty fast. And everyone runs a little differently. So I'm going to teach you my way, whether you like it or not. So we're going to go with communication. So now I'm going to get into some of those core micro skills, and I'm going to be picky because this is the most common patterns that I'll see in the majority of relationships. So there are 2 categories of communication, verbal and nonverbal, and most people hopefully will know this. Any guess on how much communication is done non-verbally? 85 to 95% of all communication is done without opening your mouth. So the issue here is we spend a lot of time communicating with words in session when it's really not the majority. However, the issue that comes in is the words are the issue that we get. The words and the assumption of what's going on is where we get into the problems in relationships. So if you want a good and healthy relationship, watch your words, because the assumptions from the nonverbal communication, given the words, is where we get into issues. So the words that are spoken, words signed, words written are your verbal stuff. Nonverbal includes your tone, your posture, your body language, the gestures, the facial expressions, the eye contact. And so when those nonverbal cues aren't aligned or are potentially questionable with very sensitive clients, assumptions run, and then we get into problems. even though technically a problem may not be. Culturally, there's some interesting dynamics. For instance, Aboriginal clients view eye contact, especially with an elder, as a disrespect to that individual. So you need to know some cultural dynamics when we're playing with couple work. You know, I have some people that, you know, they're just naturally twitchy or, you know, their legs are shaking. And so you get the common ones are like, why are you shaking so much? You're angry, aren't you? You know, you're stressed. And you're like, you know, I know you're angry, because it's like, or my classic, you're kind of frowning because you're trying to make sense of it or think about it. And out comes I know you're angry at me because you're frowning at me. And therefore, so again, these assumptions based on nonverbal communication is where I see the most common problem. So, or the dynamic in couple dynamics where, and I'll say most of my time, again, generalizing, my women need the feel-or more often than my men. And the feel-or is a strategy in conversations to show good communication skill set non-verbally. This is before we even talk. So one of the first times when I sit with couples and they're talking, they're usually sitting on the couch and they're facing me and they're having a conversation with each other while they're facing me, and it really looks awkward, and they may look at each other, but all the nonverbals are not aligned. And so once I get them to talk about a topic, I want to see what they do. So I'll open up. Good, let's start talking about this volleying perspective. I want to see what you guys look like when you're talking about this topic or debate that we're looking at. And commonly, we're missing a bunch of these. In my office, I playfully will do this to teach because I will do none of these as a therapist to show them what it feels like if they're doing this, to let them experience it. And so I'll tell you what these are first, and then they'll tell you what I do, just as a little playful dynamic. Careful, some couples may not always appreciate it. I'm a bit, I don't know what's a word, spunky, little playful. I'll use playful. And therefore, they, you know, by the time we're doing this, I'm doing it with a smile on my face and I'm teasing them in this process. But I'm also doing it from a positive lens of seeing what we're doing. So facing each other is the first one. And so I want them to sit on a couch or move the chairs so that they're actually facing each other, not with their face to face. I might look at distancing, but that's another component. Eye contact is the other one. Lots of people will not make eye contact. And people are very subtle in being able to see that. If your eye contact is off by about half an inch, so if you're playing with someone at home and you look at them in the eyes and you shift your eyes down half an inch from looking at their eyes, they're going to go, something's not feeling right, even if they can't fully see it. Third one is leaning forward. And so leaning forward does not look like this full leaning forward. It's a leaning forward, kind of like what I'm doing right now, is I'm showing of interest enough leaning forward versus, and I'll show you what I will do opposite of this when I'm working with clients. I don't know if the camera can show it, but I'll do my best. Open posture is having your legs kind of open enough, your arms open enough, lack of crossed legs or arms. So I'm just showing that it's kind of, I'm open here, there's nothing hidden. I don't have a table in front of me, and some, old school therapy is, the psychiatrist, psychologist sitting behind the desk, covering everything, sitting back, legs crossed, head, so we're getting into this. I'm really not that interested into the process, although I might be relaxed. I'm too relaxed to show interest in the system. When I'm playing with my couples, I will actually turn my chair, I'll turn my chair to the side. I'm going to say, it's good, we're going to do couples therapy like this, and how does it feel? And so they get really uncomfortable because this is just not right, because I was doing good before. And then I tell them, fix me so that it works best for you. And then I let them struggle through these 5 key areas by naturally getting me to do that. If I teach them and just tell them, people don't tend to learn as well. As they go, okay, you need to look at me, then I'll just kind of do this. No, you need to face me. Okay, so then I'll move face, and I'll still cross my arms, and still cross my legs, and lean back. And okay, this still doesn't feel right, but sometimes I can't get it. And so they okay, you need to sit up. And so what I'll do is I'll I will sit up. I can't cross my legs in this. And it's like, well, now you look really uncomfortable. It's like, okay, what do I need to do? Well, you need to relax, okay? So now if they've told me to sit up and relax, then I'll kind of sit back. And so then I got to go, yeah, they might get 4 out of the 5. Some are really good and get all 5 pretty quickly once they get their head around. But as they tell me I need to open up my arms, I say, good, now that you got it, you can see that difference. Now you got to train each other. And so I get them to work with each other to get them to optimal. Good is not good enough for me in the nonverbal setup. I want it like very good to excellent, saying, is this is the way I like it. Oh, good. If they need to put a pillow, they need to get comfortable, they need to move things around, I don't care. I need them in an optimal nonverbal dynamic before we start talking, because I'm going to just sabotage myself if this is not ready. Okay. Make sense? What not to do. So here are the little micro skills. Avoid not language. So communication goes wrong when you specify what you do not want rather than what you do want. And you'll hear this. Well, I hear it a lot because my ear is very sensitive to it. But lots of people come in, and when I say, what do you want? And they go, well, I don't want this. I'll play with my Christmas. What do you want for Christmas? Well, I don't want socks and I don't want a tie. Well, you still haven't told me what you want. I know what you don't want, but it's not giving me a clear direction on where we're going to go. So I really want to train them to frame it in terms of what do you want? And so some of my students, I don't really appreciate it because I need them to ask, well, what do you want from me? Because I'm going to ask them. They don't know. Then I need them to help frame that so that we can get movement. Or I might give them some suggestions, but they still have to confirm it. If you, I want you to watch about it becoming a venting session. This is not couple therapy, so be careful on that. And again, some people will just move it into if they just talk about what they don't want and what they hate and what they don't like, then it becomes a venting session and it's not very clear. So be clear on the intent of the communication, gather the information, process it out loud. Solution finding is kind of really part of the things that we're trying to work on. But even if they're doing all of that, that can be okay in the beginning and the middle. The last thing you need to let them know is what do you want? What do they want from their partner? What do you want from them? What do they want from you? Get that clarity and try to get rid of the not language throughout the process. It just streamlines it because it also adds to Gottman's positivity mindset. You're coming from a positive approach. When you're talking about nots, it's usually from a negative approach. You can replace almost every not with a something. Even if you go, instead of this, I would like this. Then we just now have a replacement dynamic. This is fine. Ask way more questions is the other pattern to watch. So start with your open-ended questions, which moves to tighter open-ended questions, which may look, if they kind of still get stuck, it's alternative questions. And then you moved into closed-ended questions if you really need to kind of help them make a commitment. And I will use get rid of why. So avoid why, because why is the most complex question to ask and usually encompasses the who, what, where, when, and how. So as a result, people go, well, why'd you do that? The two most I usually ask them when people go, why do we use not why, or get rid of why? I say, well, what are the two most common answers for why? And people go, I don't know. Well, that's one of them. And the other one is because. And because is a justification answer. And as soon as you do a why and a justification answer, you get people on the defensive. And that's not going to help open things up. So questions that I will ask is, what are you thinking? How are you feeling? What do you want to do with this? Where do you want to go after here? When would you like to do this? Who is this? How would you like to proceed? How are you feeling? As you kind of do those, what are some of the reasons? Looks like why, but it's not a why. It's a tentative approach to help them explore some of those dynamics because they don't know what's why. So to help streamline your therapeutic process with couples, just get rid of why. It's not really why is that once you answer all those who, what, where, when, how, and then we'll go with the why. So for most couples, it's not relevant, not important, doesn't work. Also, when asking questions, it's important to try to find a balance. And so lots of individuals come into session thinking it's about them or personalizing it. It's not about them at all. Your question is about you. Your expressions all are about you. My expressions and my feelings and what I'm doing is all about me. It could be related to you, but it's not about you. And so I have to really differentiate that and pull that apart. And so as a result, we have this me versus you versus us. Not necessarily versus, but it's we are aware that these are those different dynamics. And so do you love me? Do you like me? Could be an example of me asking you a question. What do you like is me now framing it to you. And what do you want, so that I'm aiming at you? And then what do we want to do? Because what you might like and what I might like might be very different. And so given those two differences, what are we going to do about it? What are your options? Let's make some proposals. And it could be you go left, I go right, and we're okay with that. Or it could mean let's split the difference. And so as a result, I'll see this with bank accounts where we have 3 accounts, which is the his, hers, ours, so to speak, if they're a straight, cisgendered kind of couple. And so you can have, my money, your money, and our joint money, so that I have a feeling that I can actually use and spend my money on something that I want without having to go through you, because you want to control my money because you want to make sure it's the best. And if I'm a saver and you're a spender and we have one joint account, we have a problem, because I'm going to resent you if I'm the saver because you keep spending it on things that I don't approve on, or even vice versa. And I've seen that even with psychologists, where they have one joint account and there's this little chase where, well, you spent something for yourself, so I want to make sure I want to spend something on myself, and we don't have enough money because we keep doing that regularly to try to balance each other out, and it drains the account, and now we're in a stress situation conflicting about it. So by kind of splitting it up, it allows for differentiation to occur and kind of that separateness, but still a joint lens. So another lens. There's some little articles on his, hers, ours, and stuff like that for you to take a look at. At Insight, we have I got like probably 2,000 handouts. So if you're there, you can go onto our handout library list. I'm sure Kells has, each agency has like handouts kind of attached to that. So just find what works for you within that system and see as it relates to what we're talking about here. I've talked about this already numerous times. Watch superlatives. Superlatives, the exaggeration of or a hyperbolic expression. Always or nevers. And just watch that. Lots of times, if I need to validate someone, I can validate that that's how they feel. Feels like it's always. That's a valid statement. Or it feels like it's never happening. That's a valid statement. But when you say it never happens and you've never done this, and the other party can bring in one case, semantically they're incorrect. And even though you might not feel like it's a big deal, or this is a big deal between the couples that I have to now help refine and clarify, because they would not want to be accused of doing something always or never if they can prove that they've done it. So it's just, again, playing with that feeling component versus the semantics and correctness of their language. So I become a little bit of a language monger to make sure that they're communicating clearly and explicitly what they're actually kind of wanting and feeling, rather than flailing all over the place or expressing lots, because, once you say it out to your partner, if you're saying it in session with me individually, yeah, you can talk about whatever you want. I might still, challenge your question. But as soon as someone else hears that, you can't take that back. They've heard it. It's in their head. It will impact them whether you like it or not. And now I spend more time repairing this process. So be aware of that dynamic when you're working with couples and they want to say what they want, unedited, and wondering why there's kickback and now they have to clean up more mess. Ask for what you want. And again, this is another dynamic that I'll say there's a little bit more gender patterns. And the common one is the eating one. And you've probably seen some videos on this because this is a common an issue. Here are some statements that I have heard in session and I have seen throughout kind of my years of experience. You should know what I want. You've been with me for how many years? And so the issue is the one, this is a mind reading kind of dynamic, because they don't want to know. Or even sometimes they'll say, it's like, well, what do you want? Well, you should just know what I want. Well, I say, well, actually, what do you want? Well, I don't know. So you want me to know what you want, but you don't even know what you want, and you want me to guess. But if I guess wrong, you accuse me of being inconsiderate and not paying attention and not listening when you're not even clear on that system. So that is an ongoing common pattern that I've seen in a couple sessions. My other one that I like playfully would be let's go out to eat. I want to go out to eat. Well, do you want to go out to eat? Is that a question? Or are you trying to indicate a consideration? Because if I say, no, I don't really want to go out to eat, and then we get into this issue, well, I didn't really mean that, but you asked that as a question. Okay, so does that mean you want to go out to eat? So we get into this double language patterns where I have to now assume that you asking me if I want to go out to eat really means I want to go out to eat, and therefore I want you to come out to eat with me, but you never said that, and now we argue back and forth or kind of debate that. Some individuals, may naturally go there and they go, oh, you want to eat? No, I don't really. I'm okay with going with you because they're insinuating and they're reading between the lines and trying to move through there. But if you're dealing with my standard couples, now doesn't work so well. And then we move to the next question after, okay, yes, I'd love to go out to eat. Let's go. Where do you want to go to eat? Now we move into who has authority in a situation, and I need you to be aware of that. Who's choosing? Where do you want to go? Oh, it doesn't matter. No, you choose. Well, I'll go wherever. Oh, no, not that. I don't feel like that. So this is where someone is given authority to choose, and they have now taken it away in the system. And I will play with that in session. If you're going to give it authority, you've given it up. You don't get to go take it back after you've changed a dynamic, because I want to keep that boundary clear to say either let's give up 3, let's look at solutions so we can resolve this issue, rather than put someone in a double bind where you decide, but only if it's what I want, but I'm not telling you what you want, and therefore we get stalled and stuck again. And then someone's frustrated and then not going out at all. So examples of that would be, hey, can I hold your hand? I want you to hold my hand. Can you give me a hug? Or, I know I'm not feeling really, I'm not sure what I need. So can you give me some options? I don't want to cook today. I'd like to go out to the new restaurant in the mall. Is nice and clear. Hey, can you scratch my back? It's kind of itchy. Or no, can you keep scratching it because it's still itchy? Versus, well, you scratch my back, and what I meant was, I want you to scratch my back for half an hour because I really like it. But all I said was, I just want you to scratch my back. They scratched her back for 5 seconds. And now there's the assumption that that's what you wanted. And then they get resentment because they never followed through with what they didn't disclose, and they didn't get what they wanted. Again, clarify when, where, for how long is your key thing that you want to look at. Watch for assumptions. I actually ban assumptions in my session because this just gets too problematic. I only will use assumptions when I have no other options and we're gonna run. And when I'm doing couple for individual or individual for couple, I have to make assumptions because I'm assuming that the person is telling me the truth. And given their disclosures about their partner, I now have to make assumptions because I'm not actually seeing it. When I'm working actually with a couple, I'm going to get them to ask the question. Instead of saying, oh, I know you're angry at me, I was like, oh, okay, what's the face about? What's the raising the eyebrows about? Like, how are you feeling about that? What do you think about that? I get that volleying to occur so that they don't have to assume, and they get verification of their belief systems just in case. Because if all you have to be is wrong the one time, and it becomes a problem. Now, negative priming is another one, and this is a fascinating one from a hypnosis perspective as well. So negative priming occurs when you make a negative assumption about what someone is thinking or feeling or even doing, and that plants a seed in their head psychologically, and it primes them to hold on to that negative thought. And so negative priming is, I would say, as a psychologist, is so powerful that you can actually kill people with it. Or people have died. I won't say you killed people because that takes the responsibility of the person who said it to do that. but the person who has been primed may actually die. And you'll see this in some cultures where they very much believe in magical religious practices. And if you say, if you do this, you will die, and there's no actual scientific evidence for that, but people believe they're going to die because they've been told if they do it, they're going to die, and they get sick, and they have died. And so you can impact someone's mood, their health, by what you say. Wow, you look really sick today. How are you feeling? That's going to plant a negative seed in your head. I know you're angry at me. How are you feeling? You think they're going to be able to be honest because you've already planted the seed. And so when you're working with your couples, watch for the negative priming. Make sure they're not saying something negative. If they're going to ask a question, ask a clean question. No assumptions, no negative priming, clean question. And then as you start working with your couples and they start seeing this, they start finally catching on themselves, because it's contaminating their relationship and even themselves, leading to anxiety, depression, or facilitating more of those symptoms. More things to watch out for: navigating therapeutic dynamics. So watch out for using simple validation. Again, if someone comes in and they say their husband is abusing them, it could be true, it could be not. I want to know what the details are. Tell me what that is. And so in my one case where, the raising of the eyebrows was abuse, I had to confront that individual to say, no, that's not abuse. Does not fulfill any of the requirements. It can feel like abuse, but these are the list. And I brought out a list of these are abusive behaviors and or violent behaviors. And these are tangible, objective, verifiable versus emotionally based. And, it feels like someone's being abusive. It could have been linked to an abusive behavior in the past, but that by itself, in session with me, observing it, was not even close to abusive. So same thing with, labels, watch gaslighting. Gaslighting is making someone feel or making statements about someone to diagnose them with things, or that they're the problematic person when they're not necessarily. It could be true that it's not necessarily gaslighting, but when you come in and someone, if in this case, I'll have some cases where someone's having an affair and that person's going, I know something's wrong, this is not making sense, like, what are you doing, like, are you going out, are you seeing other people? And then they're like, oh, you're just crazy, when they're actually being able to pick off those nuances, and it's just a way to kind of get out of the circumstance and blame the other person for their observations. You may be asked to diagnose or comment on someone's disorder or behaviors. That's okay. These are kind of teachable moments. If not, I'll bring out my DSM. I'll kind of go through the criteria. I'll go, I don't know from what I'm seeing you in session. I've had lots of cases. Oh, my wife is borderline, or my husband's narcissistic. It's like, nope, doesn't fulfill the requirements. Again, so this is where we're going into, and they might be different at home, so they could put on their best behavior and they could have that diagnosis. That's why I have to verify, not only in session, but is this happening outside of session, if I'm going to look at diagnoses or these kind of behaviors. But this is a great opportunity for your teachables. And again, make sure you're facilitating volleying. You want to get the couples to do the work, and not you. You're facilitating their interaction and guiding them through that process so they get more practice in session, not lecturing. So there might be a bit of psychoeducation, especially in the beginning sessions or the beginning parts of the sessions, but you want to move into that, utilize those skill sets after you teach them only like a few points. Once they do feel or in my not language, I'm now having them run it. I'm having them volley, and we're going to work on those issues and actually experience it and refine it right there so they have practice. Now, another dynamic is, and we've talked a little bit about this recently, is you have to look at the power differential in terms of what's going on. So who has authority in the situation is the thing that we're kind of looking at. So the difference is between asking and informing. What are the rules of the couple? Could be, can I buy a motorcycle? Does that mean I need your permission to buy a motorcycle when it's really either my money or we have this agreement? Or I'm just informing you that, hey, I want to buy a motorcycle, and what are your thoughts about that? And so again, clarity of the question, clarity of that dynamic. Are you interested in co-buying a motorcycle? It could be my proposal. And they go, no, then okay, do you have an issue with me buying a motorcycle? Yes. Doesn't mean it's going to stop me from buying one. I need to know what the negotiation pattern is going to be for that couple. Now, when we move into number 3, hey, can I buy some cocaine and have it in our house? I have to decide. You might go, no, no, no. Well, like in some relationships, this is acceptable. Yes, I don't, because I want some too. Welcome to part of why they're in therapy. Is this acceptable in the relationship, even if it's not acceptable to you? So I have to help them navigate what are the acceptable terms in the relationship, who has the authority, and is this a dynamic in the relationship? So for instance, if I'll play with this as a circumstance. If I own a house and my girlfriend comes in to live with me and I want to buy cocaine and have it in my house, that's my legal authority to have it in my house. She might not want it and might not accept it. That might be a relationship breaker, but I still have the authority to bring that in my house. So it's knowing who has the authority in the circumstance given the area and the scope. And, is there a decision-making role? Because sometimes you'll have, the backseat driving principle where the person who doesn't have any authority but is uncomfortable is making everyone else uncomfortable because they want them to follow their rules when they actually don't have the authority. A common one was driving. I don't want to drive, I want you to drive, but I want you to drive within the speed limit that I'm comfortable with, and so, there can be negotiation there, but sometimes those requests are unreasonable. I want you to drive 50 kilometers below the speed limit because I'm stressed when you drive and I want you to drive to the places that I want, and I want to make sure that, I have this music while I'm listening because I don't want to be stressed when I'm driving, and or you can't talk to me, or you need to talk to me and drive while I'm driving and pay attention to the road without getting us into an accident. So there are some, ridiculous dynamics that may occur. So it's who has the role decision. So when I'm talking about the driving dynamic, it's, if the driver, and I'll play with this from timelines, if the driver gets to make the decisions because they're the ones that are responsible. If they want to be early to their social engagement and the other party isn't willing to negotiate with that, or they're both not willing to negotiate, we have gridlock. Now, how are they going to navigate if someone wants to be half hour early and the other wants to be an hour late? Well, we have options. Good. Either I'm going to take my car, you can take yours. Well, I don't want to drive. Okay, so you don't want to drive. You want me to drive, but you want to be an hour late, and I'm not comfortable with that. Gridlock again. So this is that fun part as part of couple therapy, is what are the options and proposals that the couple can bring forward. I can bring mine to help them navigate this gridlock or these issues. But ultimately, they might have to make that his, hers, ours, or his, hers, ours dynamic. It might not work. You might have to go drive if you want to spend an hour and a half later coming to that party when I want to go earlier and see the stuff. And that's okay. And if they want to sabotage that to say, well, then I'm not going then, that's their right. So hopefully we can come to a good negotiation. Even if it's not this one, I might give this one. Fine, I'll do this one, but next time you got to follow. And so we have this balancing effect later on. Common other dynamics on who has authority is whose money are we using, right? It could be couple money, it could be individual money. You take me out on a date, but I want you to pay, right? But I'm going to order this. And it could be the family stuff where we're both agreed to whatever we're doing, and that's fine. And therefore, I will recommend 3 bank accounts. It's kind of his, hers, and our bank account, or even it could be you each have your own individual bank accounts and you have a joint credit card. So you kind of, when you're doing your joint activities, it's kind of put on that credit card and you split it kind of down the line. But you might also have to prorate that. So sometimes it's not fair. We might make an agreement that we're going to prorate and have a third bank account, and we're going to take 30% of our income and pop it into that joint third account because one of the couple makes more money. And therefore, they're going to just contribute more because they can. It's an equal percentage versus an equal amount, because sometimes it gets really wacky if it's the amount dynamic. So again, that's just for the couples to negotiate and navigate that. I prefer percentage versus not, because sometimes there's a big disparity and they can't afford to run the same amounts. And then what are the hard boundaries and soft boundaries in the relationships? So hard boundaries are the no-nos. This is, you're not allowed to do this under any circumstance. End of discussion. The soft boundaries they're negotiable. I could be convinced, or I could be, okay with that if these things are set in place. And that could be, going out with friends. There's lots of dynamics, or, I want to buy a car, and the hard boundary is, sorry, the car, we only can afford this amount, and therefore hard boundary is nothing beyond that. Soft boundary is, give or take if we're going to use it and we can look around it. If you're going to go out with your friends, it could be a hard boundary is, you need to be home by like 2 a.m, or I'm going to, lose it, versus a soft boundary is if you call me, throughout that time and just assure me, then it might be fine. You can stay out as long as you want, but I need to know what's going on so that I feel secure. There's lots of navigating dynamics, so feel free to help navigate those components in those systems. A little bit more on communication basics. So I've covered a little bit of these. So these concepts ultimately will help eliminate most of the communication issues that can occur between a couple. Ask questions. Who, what, where, when, how, and not why. There's my superlative never. If you can do a never, I can't think of a time when I would actually do a why in a couple. So watch not language, don't use superlatives or use, non-superlatives. Ask for what you want, then negotiate or make proposals. Do not make assumptions. So eliminate assumptions in this process, especially at the beginning. Avoid your negative priming and explore who has authority in decision. A little bit on timeout rules. So the person who initiated a timeout is the one who gets to and has to come back. So when there's a couple who need to pace and balance things out, a timeout is where someone can call a timeout anytime, any number of times, to be able to allow themselves to pace, to be able to kind of distance themselves so that they can kind of cool down and then come back. So when you call a timeout, which could be non-verbally, it could be verbally, you initiate that, you take the time out, you usually take about 20 to 50 minutes. It takes about 20 to 50 minutes for people to actually cool down. If you use your ice pack method, it speeds it up. Timeouts are not walkabouts or stonewalling. So a walkabout, and I've had one client, I remember that one. Client went on a walkabout as a timeout. I'm taking a timeout, I'm gonna go for a walkabout. But he didn't indicate the person they're with who knew what a walkabout is. In Australia, do you know what a walkabout is? Anyone? No? A walkabout is where you go out and basically you find yourself. Commonly, it's about a month. So they took off and left for a month to go on a walkabout to explore really what they wanted in life in a whole bunch of areas, and did not inform their partner when they're coming back that they went on a walkabout, and wondering why they were all mad when they came back because he just disappeared. No contact for a month. I had one case of that earlier on in my career. And the stonewalling, as we talked about, that's just purposely putting up the wall, the hand, and say, I'm not talking to you about this, and not coming back to kind of process it later. So here's a little bit of an example of our certificate of completion. In order to get these, you need to fill out the forms. What are they? The evaluations. So that's something that's important to kind of fill out if you want one of these, to kind of fill it out and go from there. So we have kind of finished, our takeaways. There's a whole bunch of takeaways from here. Understand, the theoretical foundations of some of these components, things to watch for. This is level 1, or part 1 of this couple stuff. Part 2 will be next month, and I'll go into the continuation of this, into deeper topics that all of this stuff you need to know to move into the next level.